Welcome back, everybody. And today we are going to be looking at fitness performance and nutrition considerations. In this chapter, we will take a look at the big picture of how we use food as fuel for activity. And as per usual, we will start off with fake or fact. And the more protein you eat, the more muscle you will gain. I hope that you say no. Because although protein does impact muscle mass, the fact is that the vast majority of athletes and college students meet their daily protein. Protein beyond what is required equates to extra calories that most do not need. It is best to time your protein intake in relation to your workouts. For instance, consume ample protein before or immediately after a workout for muscle repair and recovery. Specific protein and nutrient recommendations are discussed in detail in this chapter and vary by age, type of activity, intensity, and other factors. There are some terms in this chapter that we need to get ourselves familiarized with. So when we talk about physical activity, it is any movement that requires energy, and the benefits of physical activity outweighs the risk. When we talk about exercise, it is physical activity that is planned and meant to increase fitness. And physical fitness is the ability to perform a moderate to vigorous activity without getting excessively tired. Then we have different levels of physical activity. When you look at the physical activity guidelines, you will see the terms moderate intensity and vigorous intensity. When we look at moderate intensity, it means aerobic activity that increases heart rate and breathing. And when we talk about aerobic activity, it's where we use oxygen to meet our energy demands during sustained periods of activity. And so when we talk about moderate intensity, basically it's activities like brisk walking, dancing, bicycling on a level surface. And we can also talk about vigorous activity. And that is aerobic activity that greatly increases heart rate and breathing. So if you're engaging in vigorous exercise, you'll start huffing and puffing, and it's going to greatly increase your heart rate and breathing. So some activities are like jogging, tennis, swimming, bicycling uphill. And then there's also muscle strengthening activity, which is an important aspect of a fitness program. And basically, it's going to help to increase muscle strength, power, and endurance. And this figure highlights the benefits of physical activity. We don't need to dwell on this because they are very intuitive, but it's going to benefit everything. It helps to reduce chronic disease risk, it helps with body composition, and it helps your brain. From head to toe, there are benefits of physical activity. Look at the points in the chart and make sure that you know those. So if you want to start engaging in physical activity, we first need to start assessing your current level of fitness. In some cases, it is beneficial to seek medical advice before getting started. Men aged 40 years or older and women aged 50 years or older, anyone who has been inactive for many years or those who have an existing health problem should discuss their fitness goals with their primary care provider before altering physical activity patterns. Health concerns that may require medical evaluation before beginning fitness programs are obesity, cardiovascular disease, hypertension, diabetes, chest pain, and also your arthritis. So, although your goal may focus on just one aspect of fitness, such as being able to bench press your body weight, a balanced fitness program will include various types of activities, such as aerobics, muscle and bone strengthening, balance training, flexibility, and more. And we use the FIT principle, which is your FITT, and as we see, it stands for frequency, intensity, time, and also type. And frequency means the number of days per week. And when we talk about intensity is how hard you work, your heart rate, and also resistance. Time is how long in each session. And when we talk about type of exercise, it's just the different types of exercises that you are engaging in. And so this table summarizes the American College of Sports Medicine's recommendations for a general fitness program. And remember, when we talk about aerobics, it means with oxygen. And aerobic activity is intense enough and long enough to maintain or improve your cardiorespiratory fitness. And listed here are the three components of aerobic activity: intensity, or how hard a person works to complete the activity. And usually we describe that as moderate or vigorous. And ways to determine this is using the maximum heart rate or the rate of perceived exertion, which is the RPE scale. And when we talk about frequency, we talk about how often a person engages in aerobic activity. And the duration is how long a person engages in the activity for one session. So the ability to perform aerobic activity depends on the health of your heart and lungs, the organ systems that provide oxygen to the cells of the body. Also, when we talk about aerobic activities, it usually forms the backbone of a fitness program. And indeed, many of these benefits of fitness are direct effects of aerobic training. So how do we determine exercise intensity? And these days, most wearable fitness trackers now contain automatic heart rate monitors. And if you do not own one, you can manually check your heart rate by following these steps, which is to stop and count your heartbeat for 10 seconds and multiply that number by 6 to determine your heartbeats per minute. So when we look at the maximum heart rate, it's taking 220 minus your age. And when we first start off a fitness program, we are looking to achieve anywhere from about 50 to 65% of that maximum heart rate. At an intermediate level, it's about 60 to 75% of the maximum heart rate. And if you're experienced, it's about 70 to about 85% of the maximum heart rate. So an example, which you see on the right-hand side, is taking 220 minus 20 if you're a 20-year-old, and it will give you 200 as a maximum heart rate. So when we're talking about an initial program, about achieving about 50 to 65%, we take that 200 times it by 50% or 65%, and we will get somewhere about 100 to about 130 beats per minute. And as you progress and become more physically fit, you can work up to a higher target heart rate. For intermediate exercises, like I said, it's about 60 to 75%. And for trained exercises, it's about 70 to 85% of that maximum heart rate. And this chart just kind of illustrates the heart rate training, and it shows the number of heartbeats per minute that corresponds to various exercise intensities. And we can also look at this diagram, which is the rating of perceived exertion scale. And when engaging in physical activity, a rating of 5 or 6 produces noticeable increases in breathing rate and heart rate. So the range starts from 1 to 10, with 0 being nothing at all, and 10 being close to maximum. And we want to aim for 4, where you start to notice that significant results, especially when we talk about building and maintaining aerobic fitness. And you should still be able to work hard, and while you are engaging in physical activity, be able to kind of talk with your exercise partner, and that is what we call the talk test. We can also look at muscular strength, and it refers to the maximum force a muscle can exert against a load at one time. Muscular endurance refers to the ability of the muscle to perform repeated submaximal contractions over time without becoming fatigued. And athlete training for muscular endurance may bench press 80 to 100 pounds for several sets of 8 to 12 repetitions. Both muscular strength and endurance are important aspects of muscular fitness that relate to health for athletes at all levels. Muscular power combines strength with speed for explosive movements such as jumping or throwing. And power is a crucial aspect of muscular fitness for many athletes. And the physical activity guidelines recommend including muscle strengthening activities in your fitness program on at least 2 to 3 non-consecutive days per week. because it will allow your muscles to recuperate. Flexibility is an often overlooked aspect of physical health and tends to decline with age. Flexibility, often called stretching, refers to the ability to move a joint through its full range of motion, and it helps to improve stability and also balance, which can help then reduce the risk of fall and injuries, especially among older adults. And this diagram just shows a sample fitness plan, and you can go through this yourself, but this fitness plan incorporates aerobic, strength, and flexibility exercises. And it's important to plan for adequate warm-up and cool-down periods as part of your physical activity routine. So we should aim for about 5 to 10 minutes for both activities. And begin by warming up with low-intensity exercises such as walking, slow jogging, or any low-intensity performance of the anticipated activity. During cool-down, slow down to low-intensity activity followed by stretching. It is appropriate to do the same physical activities performed during warm-up. Although the cool-down does not actually prevent muscle soreness, it does reduce the dizziness or lightheadedness that can occur with an abrupt end to a vigorous workout. So, like I said, aim for 5 to 10 minutes of both your warm-up and cool-down before and after engaging in physical activity. So even after all the efforts of assessing baseline fitness, setting goals, designing a program and getting started, it turns out that maintaining a physical activity program may be the hardest part. And to stick with a fitness program, we kind of look at some of the recommendations over here, but it says start slowly, vary your activities, include family and friends because they act as a support system, kind of looking at revisiting both short and long-term goals and making sure that you set aside a specific time of the day that you plan to work out, and also reward yourselves when you're achieving your goals, and do not be hard on yourselves, for these occasional setbacks, because what we want and what we are aiming for is that long-term benefits to your health.